Hello, do you hear me?
All right. It's time to start our day.
Yes, how are you?
We have a long day. Thank you for coming today in our second annual conference of EgyptAir Hospital. We are pleased to have you today in two extensive workshops and presentations about medical tourism. And we are pleased to have you here today. Hopefully, we will meet and interact within the next presentations and workshops. السلام عليكم. اهلا وسهلا بيكم في مؤتمر مصر الطيران الثاني السنه الثانيه. عملنا هايلايت السنه دي على السياحه العلاجيه، وهنبدا فعاليات المؤتمر ببرزنتيشنز وتليها ورك شوبس. الحقيقه المؤتمر السنه دي مركز على السياحه العلاجيه والديجيتال ترانسفورميشن، ونتمنى ان انتم تشاركونا وتتشاركوا معانا في المؤتمر. هنبدا السيشن الاولى مع استاذ دكتور سميح عامر، استاذ القلب والصدر، جراحه القلب والصدر، والمساعد وزير الصحه لشؤون السياحه العلاجيه لشؤون السياحه العلاجيه. فنرحب بيه ونسمع لكلمته. دكتور سميح عامر، cardiovascular surgery and senior advisor of the Minister of Health for health tourism. اتفضل.
بسم الله الرحمن الرحيم. First of all, I would like to thank Dr. Ayman Salah and the organizing committee for the kind invitation to be with you today. It's an honor for me actually to be a speaker in this conference with the recognized guests, and I used to be one of the doctors of EgyptAir Hospital long time ago, and we started maybe in the beginning of 90s with Dr. Mohi Hamed. He was the chief of the hospital, and we had programs that time, advanced programs ahead of what was going on in Egypt, all over Egypt. He used to take us to the States and to all over the world to start endoscopic surgery. He was interested, of course, in abdominal endoscopic surgery, and for me, I was interested in video-assisted thoracoscopic surgery. He's doing all kind of surgery in the chest with the thoracoscope. So I am one of the EgyptAir hospitals generation, old generation. Okay. Now we are talking about the health tourism. There is an important point to mention that health tourism is not a new program in Egypt. If any of us visit any of the hospitals or private clinics, we'll find many patients coming from all over the world, especially from Africa and in the Middle East, seeking medical advice, and in the hospital doing surgery and all this stuff. However, we don't have actual statistics about how many patients coming to visit Egypt every year. This is one point. Second, where those patients are going to, which hospitals, what are the results, what are the specialties. We don't have registration. It's a big problem in Egypt, registration. We don't have registration at all. We don't know how much they are paying, and that's why the reflection of this pitfall is the ranking. Our ranking among the international medical tourism market is not satisfactory for us. If we talk about medical tourism, if we would like to know what is the size of medical tourism all over the world, 2022 the international trading for medical tourism was about $130 billion all around the world. And this amount expected to be on 2030, $300 billion. It's a lot of money. That's why you have to think seriously. If we have all the criteria to participate actively in these programs all over the world, why we are not doing it? You know, in medical tourism, we have patients traveling for several reasons. We'll mention it later on. But the most specialties for traveling is the cancer treatment. Either it's not available in some of the countries, or the technology is not advanced for dealing with those patients, or for the cost of the treatment for cancer in some countries is beyond the ability of most of the patients. So the first is the cancer patients, second orthopedic patient, especially joint replacement, cosmetic treatment, cardiovascular treatment, either medical or surgical, IVF and fertility, neurological treatment, and dental treatment. These are the common specialties for which the patients travel from a country to another. We know that health tourism is divided into medical tourism, wellness tourism, and wellness health tourism. Wellness tourism mean that the use of the natural sources or resources for helping the patient, either to decrease the pain or to cure them. Medical tourism is if the patients are dealing with hospitals, you know, all drugs, medical treatment. Wellness medical tourism, if the patient is traveling for cosmetic reasons, for other reasons, palliations, and all these stuff. Let us talk about the wellness tourism. Egypt is a very, very rich country in all sources of natural sources for treatment. We have 1,356 silver sources for treatment, and we have the black sands. Egypt has more than 60% of the black sands which is present all over the world. What does it mean? These black sand help to cure some patients with skin disease and rheumatoid, or even chronic fatigue syndrome, which is very difficult to be treated by the ordinary medication. Black sand is very rich with the radioactive materials at safe level, which can help the patient to cure without any harm. Why patients travel from place to another? We have several reasons. First is the cost. I can say it's the most important cause of traveling patients seeking medical advice is the cost, and it's a very big advantage for us with the present currency, the dollars related to the Egyptian pounds, I think it's a very, very strong positive point for us. Second is the quality of care. If a patient knows that he needs a kind of surgery somewhere, but he can get a better service in another country, and he calculated the cost and we find it's okay, it's more or less reasonable, so they travel for that reason. Third cause is the combining leisure vacation and treatment. This is more common among the MENA area, Middle East and North African area. Patients seeking medical advanced technology like robotic surgery, or nanotechnology, stem cells, these kinds of technologies, which is not available in every country. Referral and recommendation either from the treating physician or from the insurance company. Lack of local expertise in the country they are living in. And one of the most important reasons why the patients travel is the long waiting list in their countries. If you can see, for example, in USA, for example, for the knee replacement, the waiting list is more than 2 years. For endoscopy, GIT endoscopy, the waiting period is more than 15 months. Of course, cosmetic surgery is not covered by the NHS in UK, so they are traveling for that reason. These are the most common countries which provide medical tourism service. Unfortunately, although we have all the criteria to provide medical tourism service, however, our ranking is the 26th among 43 countries providing this kind of service. The commonest tourists coming to Egypt are from East Europe, followed by Middle East, Western Europe, and lastly Africa. The total number of tourists visited Egypt last year in general, tourists in general, were 12 million tourists. Our objective, of course, is to make Egypt one of the top global destination medical tourism by 2030. What are the tools which we can use in order to have a program for medical tourism? First of all is to have the IT platform, and we are about to finish the IT platform for Egypt. Ministry of Health is working hard for the last 8 months, and we in 15 days inshallah will be able to activate the IT platform, and it will be announced by the Prime Minister. Of course, we have to work together with the insurance companies, with the health providers, with the brokers, with the hospitals, accredited hospitals and the medical centers, and we have to have an arrangement with travel and accommodation partners. We have to work hard by arranging conferences here in Egypt and outside Egypt. we have strength points actually, which will encourage us to work hard for the medical tourism program. First of all, is our history in tourism in general. We have medical staff, very highly trained and qualified medical staff, either doctors, medical Egyptian doctors working in Egypt, or the Egyptian doctors working abroad. For example, for UK only, there are 10,300 Egyptian doctors working in UK in different specialties, and among them there are 491 professors or senior consultants in different hospitals in UK. We have a very highly qualified and accredited hospitals and medical centers. The accredited hospitals now in Egypt either taking the Gahar accreditation, TIMOS accreditation, or JCI. They are exceeding 35 hospitals and medical centers till now, and I expected by the end of the year it will exceed 60 to 65 hospitals. We have the most important thing, the competitive prices we have. You know, we are the best packages. We have it here in Egypt than anywhere else. When we started working together for this program, the medical tourism, try to pass. Actually, when we started to have this, we decided to have this program for medical tourism. The first thing is to get support for the government. This is very important for us, and that's why we established the higher committee for medical tourism, headed by the Minister of Health, and this committee is responsible for the strategies and policies for medical tourism. The second thing, we finished the IT platform, which will be activated within 15 days. Then we worked hard with Gahar and the TIMOS in order to activate and encourage hospitals and medical centers to join the programs for accreditation, and that's why the number of accredited hospitals, I think, jumped in the last 5 months to the double. And we started to sign programs with the other partners which can help us in our program. Now we have IT platform. Second, we have a medical visa which wasn't present before. Third, we have agreement with EgyptAir to give a discount, a special rate for tickets for those coming for treatment in Egypt. We have a very special rate in hotels for those having the medical visa at the same time. And we started to have a marketing campaign outside Egypt, in Africa, in Europe, and in the Middle East. This is a comparison for the prices between Egypt and other countries. And there is the last thing I want to tell you. What is the role of Ministry of Health? Ministry of Health is not a third party. Ministry of Health is acting as a regulator and in governance, in supervising, but we are not a partner in the service providing. We are dealing with the private sector and with the public sector at the same time, but we are not a partner at all. These are some of the steps we had done, and I tell you something, we in 15 days inshallah will be ready to activate our platform, and will invite all the providers to join the platform, and there will be a strong system for referral, for marketing, and I hope this program will succeed. And I wanted to say something for EgyptAir Hostel. EgyptAir Hostel is a leading hostel in accreditation, a leading hostel in technology transfer, and a leading hostel in the program for medical tourism. Thank you.
Thank you, Dr. Samir. Ladies and gentlemen, welcome to our annual Congress, EgyptAir Hostel. Now, I would like to present Dr. Wala Abdulatif, Professor of Medical Microbiology and Immunology, Faculty of Medicine in Shams University, Gahar Board Member, IPC Consultant. دكتورة ولاء عبد اللطيف أستاذ الميكروبيولوجيا الطبية والمناعية، عضو مجلس إدارة جهار. اتفضلي.
السلام عليكم. Good evening. On my own and on behalf of Professor Ahmed Taha, I have the honor to be with you today in the second annual conference of EgyptAir Hospital. Thank you for the invitation. We will talk about the role of quality and accreditation, the term accreditation in the medical tourism. In your opinion, what is the key for the medical tourism? What's your key concept or ايه المفتاح بتاعنا في الميديكال توريزم؟ انا عايزه اجيب ناس عندنا للميديكال توريزم. ايه الكي؟ طيب حلوه دي. ايه الكي بتاعنا؟ ان احنا نبني بيننا وبين الانترناشونال بيرسون، مش هقول كلمه بيشنت عشان انا مش بسيب بس في الميديكال توريزم البيشنتس، احنا بنتكلم دلوقتي على الويل بينج والحاجات بتاعت الكونفاليسنس والاستشفائيه والحاجات دي كلها in pipeline. فتفتكروا كده ايه الكي بتاع غير مصر الطيران طبعا بما انها اول عنصر البشري طبعا، ابني بيني وبينه ايه؟ اتفضل يا فندم. كواليتي اوف سيرفيس. كواليتي اوف سيرفيس دي بتعمل ايه؟ صح، هو بيلد اب تراست بيننا وبين اللي عايزين نجيبهم، اللي عايزين نجر رجليهم. تمام؟ هن اوفر فيو طبعا بعد الدكتور سميح قاله وكده. medical tourism industry والاكريديتيشن as trust building measure. Egypt as a destination for medical tourism. The role for promoting medical tourism in Egypt. هي فعلا اندستري الميديكال توريزم طبعا، واندستري مهمه، واللي بيسيك ميديكال توريزم هو عارف ان هي فاليبل اندستري وممكن يعمل فيها انفستمنت كويسه جدا. هي جروينج في الايرا اللي احنا فيها طبعا ميديكال توريزم جروينج لاسباب كتيره قوي، منها ان كل البيشنتس او كل الهيومن بينج اول اوفر ذا وورلد بيبقى عايز ياخد الستاندرد اوف كير وات ايفر فين بقى. فانا ايه الكرايتيريا، شويه الحاجات اللي اديله الستاندرد اوف كير بيها في المكان اللي هو هيختاره، وبالمره يحقق حاجات تانية، ما تبقاش بس رحله علاج او تريتمنت بس، لا انا احط له شويه حاجات تساعده او تجيبه زي ما بنقول. طيب الميديكال توريزم مش زي ما احنا فاكرين ان هو بس البيشنت هيجي يخش المستشفى وياخد الكير بتاعه ويمشي. ده يمكن 1/3 من الجيرني بتاعته، لان هي فيها حاجات كتير. من اول ما ببتدي اسلكت الهوسبيتال للبيشنت ده، هو هيروح فين، الديستنيشن بتاعته هيروح فين، دي بارت البلاننج بتاعت الرحله بتاعته، الارايفل والميديكال توريزم ات ديستنيشن كونتري، لما يوصل هنعمل له ايه، والاكوموديشن هو هيقعد فين لغايه ما يخش الهوسبيتال، لما يخش الكونفاليسنس، لما يخش الديستنيشن بتاعته. طيب والهوسبيتال ادميشن لما يبقى انا وهو انا بدخله الهوسبيتال، ايه الحاجات وايه الاوبستكلز اللي انا بسهلها له ويخش بسلاسه. التريتمنت بروسيس والديشارج بروسيس بعد ما ياخد الخدمه بتاعته، تمام. والاكوموديشن بوست سيرفيس، ما هو مش هيخرج من المستشفى على المطار، تمام. فولو اب، يا سلام لو عندي الفولو اب حتى يقدر يعملها من الكونتري بتاعته ثرو تيلي ميديسن، ده حاجه حلوه بشجعه. الديبارتشر من البلد هيبقى عامل ازاي، هنغلس عليه، هيدفع شويه حاجات زياده ولا هنسهل له الطريقه. والفولو اب لما يوصل بقى بيتهم بالسلامه. فالجزء اللي موجود عندنا في المستشفى about 1/3 من الجيرني. It's about 1/3 الجزء بتاع التريتمنت فمش جاست تريتمنت وهوسبيتال بتقدم ستاندرد كير، لازم الحاجات دي كلها تبقى complementary with each other. طيب الستيك هولدرز بتاعتنا مين؟ طبعا الهيلث كير اورجانيزيشن، البروفايدر اوف كير، الانشوررز، الترافل اكوموديشن فاسيلتيز، الميديكال توريزم ايجنتس، تيموس، الانفورميشن والتكنولوجي سيرفيسز، الاي تي، حاجه مهمه جدا. عشان اربط السلسله دي كلها لازم يبقى عندي اي تي سيستم محترم. والبانكس والفاينانشال انستتيوشن، ايه طريقه التصرفات الماليه بتاعتنا هتبقى عامله ازاي؟ ايه النيدز بتاعتي في السيرفيس اللي انا في الميديكال توريزم؟ انا عايزه اعمل العمليه الفلانيه، عايزه اخد العلاج الفلاني، عايزه اروح بسيك ميديكال هيلث كير سيرفيس. محتاجه ايه؟ محتاجه يا ريت يبقى ليسر كوست طبعا. minimum waiting time، ما افضلش مستنيه فترات طويله. quality medical care، availability of range of procedures، عندي اختيارات اختار منها، عندي مناظير وعندي جراحه وعندي ليزر، عندي options اقدر اختار منها. accessibility to trained healthcare provider، اللي بتعامل معاهم دول ناس competent وناس well trained. access and affordability of latest advancements في الحته اللي انا رايحاها، انا محتاجه اخد advanced healthcare system. opportunity to explore various destinations، يبقى عندي الفرصه ان انا اروح حتت كتير، تمام. وما حدش بقى يغلس عليا، ما يبقاش عندي لوجيستكس كتيره ولوجيستكس ايشوز كتيره تنغص عليا الجيرني بتاعتي. طب لو هنعمل كومبرومايز، نتوقع ان احنا مين اللي لا يمكن نعمل فيها كومبرومايز؟ يعني انا لو ممكن اتحمل ان انا اروح حته فيها كوست اعلى شويه versus ايه اللي لا يمكن هعمل فيه كومبرومايز. تمام، متفقين. يبقى الكواليتي اوف كير دي ما فيهاش كومبرومايز. هو طبعا should be كلها على بعضها كده بيس اوف كيك وحلوه، بس لو في كومبرومايز لا يمكن يبقى في الكواليتي اوف هيلث كير. تمام. فالهيلث كير كواليتي ده بري ريكويزيت للميديكال توريزم. هعمل ميديكال توريزم لازم يبقى عندي هيلث كير كواليتي. طبعا الميديكال توريزم بتبروفايد ثرو independent third party، حد محايد تماما. طيب والاندبندنت ثيرد بارتي دي هيقيم ويعمل اسسمنت ثرو ايه؟ ثرو ستاندردز. تمام، ثرو ستاندردز للجزء بتاع الهيلث كير وثرو ستاندردز في الحاجات المكمله اللي احنا كنا قاعدين بنتكلم عليها، هيدفع ازاي وهيوصل ايه وهسلكت الهوسبيتال ازاي وهسلكت الاكوموديشن والاوتيلز اللي هيقعد فيها ازاي. فبتاخد الرحله او التريب او الفايج بتاعته دي كلها على بعضها. طيب النيد فور ميديكال توريزم ديماند اند سبلاي حاجات كتير قوي زي ما احنا شايفينها. لا يمكن هنلاقي الديماندز والسبلايز بتاعتي without accreditation، لان انا لما باجي اسلكت هوسبيتال من الحاجات المهمه، وده يمكن هنشوفه كمان لما اتعمل سيرفي للبيشنتس، الاكريديتيشن بتاع الهوسبيتال. احنا دلوقتي ايفن جوه مصر حضرتك لما بتيجي بتسلكت هوسبيتال بتسلكت اكوردنج تو ده ايه؟ ان هي اكريديتد ولا لا، وبتحطي معايير ثانيه كتير، بس اهمها الخدمه اللي هتاخديها. الخدمه اللي هناخدها دي ثرو ميديكال توريزم كانت قبل كده بتنقصها كلمه ستاندرد. فالحمد لله دلوقتي بقى عندنا ستاندردز فور ميديكال توريزم. انا مش هروح حته علشان هي كويسه وفيها الخدمه الفلانيه بس without ستاندرد، كل واحد يتعامل على حسب هو جاي منين. طبعا دي كلها السكسس فاكتورز بتاعت الميديكال توريزم. هيلث انشورنس، واحنا طبعا اندر في الرحله بتاعتنا لليونيفرسال هيلث كفرج احنا عندنا 3 حد بيقدم الخدمه، هيئه الرعايه والبرايفت سيكتور والكلام ده كله، وعندنا في هيئه لدفع الفلوس الباير التامين الصحي الشامل، وعندنا هيئه اللي احنا بنمثلها الهيئه الاعتماد والرقابه. كل واحد بيعمل شغلته لوحده. طيب الانشورنس، الفاسيلتي سيرفيسز اللي عندي، الميديكال توريست كوست، تكلفه الخدمه عندي هتبقى شكلها ايه؟ الديستنيشن اللي انا رايحه فيها، الانفايرمنت، كل ما كانت الانفايرمنت الكالتشر بتاعت المكان دي بتقبل ديفرنت كالتشرز وفيها هوسبيتاليتي وفيها كده، كل ما كان الميديكال توريزم احسن. الاكريديتيشن اند سيرتيفيكيشن، لما اروح مكان في عندهم انتيتي بتعمل اكريديتيشن وسيرتيفيكيشن وبضمنا ان الحاجات دي بتتم according to the standard، دي حاجه كويسه قوي بتبروموت الميديكال توريزم. معظم الناس اللي اتسالت كبيشنت سيرفي او سيرفي اتعمل لتورست كانت من اهمها البيلدينج تراست، وكان البيلدينج تراست ده بالسيرفي مع الناس في حاجات كتير، من اهمها about اكتر من half البيشنت سيرفي، اكتر من 50% كلهم قالوا ان المكان ده يبقى accredited او certified او بيشتغل with standards. زي ما احنا شايفين كده اكتر من 50% بيأكد ان الاكريديتيشن دي حاجه مهمه، اللي انا رايحه اتعالج فيه ماشي بشويه ستاندردز. اوكي؟ ليه مسطره اقدر اقيس بيها الهيلث كير سيرفيس. طبعا وده من السيرفي برضو كل الناس اجمعت ان الاكريديتيشن دي حاجه مهمه، السيرتيفيكيشن دي حاجه مهمه. نفس الكلام زي ما قلنا التليميديسن دي حاجه كويسه قوي في الكوميونيكيشن بوست سيرفي بوست ميديكال توريزم. بعد ما يروح هو الفولو اب ده هيعمله ازاي؟ هيبقى سهل ان هو يتواصل ثرو تيليميديسن. نفس الكلام تراست اند اكريديتيشن، فمفتاح من مفاتيح الميديكال توريزم التراست والاكريديتيشن. زي ما قلنا كده بالخلاصه ان الاكريديتيشن ده البوابه اللي هيخش منها الميديكال توريزم. كل ما في اماكن اكريديت كتير كل ما تشجعوا الناس يجوا لها. الكومبيتيتيف ادفانتج، الهيلث كير فاسيلتيز اللي عندها اكريديتيشن بيبقى عندها كومبيتيتيف ادفانتج في الميديكال توريزم ماركت. كل ما انا سيرتيفايد وعندي يبقى انا عندي قدره على المنافسه في المستشفيات الثانيه في البلاد الثانيه. انا سيرتيفايد ويا سلام لو انترناشونال اكريديتيشن، يبقى انا ضمنت ان انا الخدمه هاخدها بناء او بيزد اون international standards مش national standards. احنا دورنا ايه كجهار؟ احنا عندنا زي ما حضراتكم كلكم عارفين 7 بوكس اوف ستاندردز، وعندنا في البايب لاين يمكن البايلوت ستادي بيتعمل على الكونفاليسنت كير واللونج تيرم كير. البايلوت ده شغال دلوقتي، بس لغايه دلوقتي احنا عندنا 7 بوكس اوف ستاندردز اسكوا اكريديتد. طب يعني ايه الكلام ده؟ يعني الاكريديتيشن بتاع جهار انترناشونال اكريديتيشن. فجهار ستاندرد انترناشونال اكريديتيشن، وجهار as entity او institution accredited from ESCWA. هو ده اللي شجع الكومباينيشن اللي حصلت، الوين وين سيتويشن جهار تيموس. الناس بتعتمد هنا في مصر according جهار او الستاندردز بتاعت جهار اللي هي انترناشونال، واوريدي تيموس عندهم اكريديتيشن. الوين وين سيتويشن عملنا ريديوس بوك، عملنا كومباينيشن بالحاجات اللي ناقصه في جهار، الحتت اللي بره المستشفيات بقى ايه طريقه الدفع والبيلينج والفولو اب والحاجات دي كلها، وبقى ريديوس بوك. عند تيموس عندهم 3 بوكس فيهم كومباينيشن او تعاون بيننا وبينهم، الهوسبيتالز، الاوفثالمولوجي، الدنتال، في 3 بوكس. ومش بس ريديوس بوك، الستاندردز قلت لان هو اوريدي واخد جهار، هو جهار تيموس بعد ما يبقى المستشفى او السنتر بتاع الاوفثالمولوجي ده واخد جهار. اوكي، مش ريديوس بوك بس، وريديوس بوست. فوين وين سيتويشن وموتيفيشن وانسنتيف للمستشفيات اللي عايزه تخش، للسنترز اللي عايزه تخش، ودخلت جهار يبقى انا عندي فرصه لتيموس، جهار تيموس. الحاجات اللي عملناها في الريديوس بوك دي، الانترناشونال بيشنت مانجمنت، نضمن ان كل العيانين من كل الاماكن واتيفر جايين منين بياخدوا نفس الكواليتي اوف هيلث كير سيرفيس. تمام. والاثيكال اسبكتس باختلاف الكالتشرز في اسبكتس مختلفه، فتعامل بميديكال اثكس واحده مع الكل، وليجال اسبكتس نفس الكلام، والبيلينج والاكاونتنج. القصه دي ما كانتش موجوده في جهار لوحدها، في الكولابوريشن ده بقى ده موجود، غطينا الحته اللي مش موجوده هنا. وتيموس في نفس الوقت ضمنت الكواليتي اوف كير في المستشفى دي لان هي اوريدي جهار اكريديتد. طبعا كانت الفيرست اول هوسبيتال تاخد جهار تيموس اكريديتيشن المستشفى مصر الطيران. فيعني انا سعيده ان انا كنت مع حضراتكم، واسفه لو طولت عليكم. شكرا جزيلا.
Thank you, Dr. Wala. Now I will present Mr. Emin Chamak. He's a founding and honorary chairman, Global Healthcare Travel Council.
Good afternoon, ladies and gentlemen. I hope you are hearing me. If you allow me to share my presentation from the screen, that I can able to start with my presentation in order to use my time useful. First of all, thank you very much for inviting me as a speaker in your valuable conference, second conference organized by EgyptAir. Well, let me introduce very shortly myself. I'm the founding and honorary chairman for the Global Healthcare Travel Council, which I was the elected president the first term in 2013 and 2015. I would like to share who we are, who is Global Healthcare Travel Council, We have founded in 23rd of March in 2013 in Monte Carlo, Monaco, with 12 member countries. Today we have reached 58 member countries actually. The aim to include all healthcare destinations to our council, to Global Healthcare Travel Council, and we wish that Egypt Medical Tourism Association or Egypt Medical Health Ministry or Tourism Ministry or Tourism Board to be a member of Global Healthcare Travel Council and to be represented in global arena. Of course, the Global Healthcare Travel Council been established in order to help to regulation and improve the standards of healthcare travelers from one country to other country. The aim to fix the standards, fix the ethic, and collaborate together and support the countries and monitoring the healthcare travels and all this industry. Because in the 21st century, the health is shared responsibility. That's why we need to work together in order to achieve our vision, which we are, our long-term vision in Global Healthcare Travel Council is to become a model organization for promotion and delivery of healthcare services to all world citizens with a slogan saying that global healthcare for all. Today, the Global Healthcare Travel Council has a very large network by integrated together with THTC, represented in 168 countries, 168 offices in 92 countries, and has 58 medical tourism association, which is member. The main objective of opening GHTC offices and representatives in international market is to give direct access to the advanced yet affordable healthcare services in member countries to those patients whose condition cannot be treated in their home country. International patient can contact our representative offices or directly or to our 58 member countries representative from our GHTC Global Healthcare Travel Council website. So it's a wide network and wide representation in ancient time medical travel or healthcare travel. The medical tourism or healthcare travel is not a new industry, actually. It is very old. Even in ancient time, so many people were traveling from country to other country, to neighbor countries or to developed countries in order to get the treatment. This is a Cleopatra Pools, which is known as Pamukkale in the region now, been built next to Hierapolis, Roman and Greek cities, where people coming and getting some wellness and treatment in hot spring waters being built by Mark Antony as a gift to Cleopatra. I put this slide especially to link Egypt and Cleopatra and the healthcare ancient history. Of course, in other healthcare city, which is Pergamum city, well known by the ancient Greek time, that Asclepios and his daughter, known as health god and goddess, created and built a total health city where they were receiving a lot of patients from different countries, and to be treated from pandemics and so many other ancient diseases was coming to Bergamo city, where they get the treatment. The past of the history of healthcare travel is not a new tradition. It is a very old one. Of course, when the transatlantic flights start from Europe from London to America, from Paris to New York, the first transatlantic jet flight was 1st October in 1958, then followed by Pan Am and by other airline company connecting Europe to America. And people in the 20th century started to travel from Europe to America, America to Europe for healthcare services. So it is also, it's a 100-year century. In 20th century started the movement. According to McKinsey chart flow, in 21st century, it's made about 20 years ago, this chart. In 21st century, also, you can see by this chart, which done by and north to south, there is a lot of movement, and there is no border anymore between countries. The world become a country, world become a united, so people can travel for many reasons, which our colleagues, the former presenter, which they mentioned about the why is the reason of travel between country to country. So those are the reason, because they are looking for affordable price, they are looking for better quality, they are looking for better treatment and technologies, and so many others. Of course, today's the present technologies being introduced to healthcare services in last 25 years, like CyberKnife, Gamma Knife, 3-beam, proton technologies, Da Vinci, robotic surgeries. The patients are looking for this kind of technologies, where to get the best technology with affordable prices. As you can see, so many new technologies being introduced to the system, to healthcare industry, as stem cell, as transplantation, as many others. As I have made some research about the EgyptAir, that they are connecting Cairo with 81 international airport, which is a good advantage to connect so many countries to Cairo. This is accessibility is very important, and also the visa access. I heard the deputy minister say that they are introducing health visa, which is very important. But one of the most important, if this health visa gonna be online e-visa, or still patient needs to go and apply to the consulate and embassies to have a lot of hassles of document and waiting and getting the appointment. If Egypt are looking for introducing e-visa, health e-visa, as they done non-tourist visas, visits visa for many, over 60 countries, according my research from internet, that these countries can obtain e-visa for work or for some other visits. If they can integrate it for this e-visa, can be very beneficial for Egypt destination, that people can travel freely. This is one of the example of Turkey. For example, 90 countries are traveling to Turkey without any visa. That's why if Egypt would like to be in between 20 top destination in the future, or top 10 destination, they need to take this action, accessibility, to make it more easy and more quicker for the people. Of course, we have done an Amman declaration in February 2017 that healthcare travel, not only medical, healthcare travel has 8 segments, which is medical, dental, spa and thermalism, and wellness and well-being, culinary tourism, sport tourism, accessible and assisted residential tourism, which is retired for the retired people. So spring hot water, spa treatments, retirement tourism, these are future of healthcare travel, because people and countries now investing a lot on medical, and they are updating and upgrading themselves. But nevertheless, the climate will not going to be cannot be changed. The mild climate of Egypt can help to have spa and wellness, can help to have retirement tourism. These are the future of healthcare travel industry. Still, medical, dental, these are still there is a future, but it is not long future, because every country are trying to develop themselves in healthcare services. So one of the most important service and accreditation issues, a colleague, previous colleague has mentioned, the accreditation is very important because it is creating the trust. So the deputy minister also has said that they are involved and they are controlling the regulation and the monitoring and etc. This is very important that they established the Department of Medical Tourism Services. These are required for medical tourism destination. Of course, the accreditation is required also. I see that TEMOS is present there. It's very important, and JCI accreditation is important. Local accreditation, I see that there is an entity by local accreditation. These are which is must. And the other point that we have experienced during the COVID time, for example, in Turkey, the safe tourism certificate was very important element to promote the destination. When you have a pandemic time or pandemic problems, the safe certification program can help by taking this initiative by the Ministry of Tourism, because Egypt is one of the tourism destination as Turkey. So this is the safe certification program can be recommended also. So the future of how the countries can survive with the new pandemic, if it is arrived, it will come. So it will. There definitely there will be some new pandemics. How to survive the healthcare industry? The country must do fast reform and develop their healthcare services, and they have to invest on human resources. We have seen many European countries, advanced European countries, being suffer because of the human resource. And Turkey was really lucky, one of the luckiest country. We had in the past visionary leaders like Mustafa Kemal Atatürk, like the latest president, Mr. President Erdogan. They made a lot of reform and a lot of invested on human resources. Of course, we do introduce also the medical tourism compliance insurance. This is one of the important element which Egypt should think about it, and to cover the complication and to cover the COVID-19 or any pandemic issues come in the future. The insurance very important for this. And also this is a chart being published. The ICU bed capacity is very important in the hospitals. When you have kind of pandemic time, you need to have enough ICU departments. The future of the healthcare, the city hospitals and campus, which are going to be built jointly by private and public cooperation, which One of the good example which we have in Turkey, Turkey and Mr. President has started building these complexes, hospital within hospital in different directions. So with 1,500 bed capacity, with 2,700 bed capacities, these are the future hospitals and future health cities where it's required really to be built and to be performed in order to be ready for future pandemics and future diseases gonna come. According to Global Healthcare Travel Council, the revenue worldwide, revenue and the income which from healthcare travel, not from medical industry, because we call healthcare travel 8 segments. According to Spa and Wellness institution, they are talking about trillion, $2, $3, $4 trillion of market because they consider each travelers, holiday travelers, getting well-being and traveling for health. So that's why they are announcing very huge amount of money. But according to Global Healthcare Travel Industry and Global Healthcare Travel Council, in 2023, we estimate that 80 million travelers traveled between countries and generated 890 billion US dollar. In 2030, we are estimating 100 million travelers to travel and to be $1 trillion, the generation of revenue. In 2050, our estimation is 250 million people who are going to travel in between countries and will generate 2.5 trillion US dollar. The current position in ranking position in between the advanced technology, advanced healthcare service provider before COVID and after COVID. Before COVID, United States and Germany was the leading countries, and Turkey was the third. But after COVID, Germany and the US has put a lot of restriction for the travelers and visas and the waiting time. That's why Turkey become the top preferred destination from 178 countries, and the Thailand and Malaysia following the Turkey because there is free travel possibility without visa to those countries after Turkey. Would like to thank you very much listening to my presentation and having me together in between you. This is my email ID, and you can write me, or if you have any question, I will be still in the panel discussion to reply your questions. Thank you very much.
Dr. Samir would like to comment.
Thank you very much, Mr. Emin, for your very interesting and informative presentation. Actually, it covered all the aspects of medical tourism, either for the past, present, and future. And there is only one point I want to comment upon, is the issue of the visa. You know, of course, any traveler can get the electronic visa, you know, with no problem, except for 11 countries which need some checkup and so. However, when we talked about the medical visa gives privileges for the patient coming to Egypt for treatment. First of all, is the platform, IT platform, booking for the for his medical condition, either in the hospital or in the clinic or whatever. Second, 25% discount in air tickets. Third, fast track service in all the airports in Egypt, including stretchers and wheelchairs and so on. Third, there is a service office in each airport in Egypt, which can help the medical patients coming for treatment. Fourth is the service of the limousine, which can be booked by limousine with a special rate or fare. The hotel booking 25% discount. And the most important thing is that when he is registered on the platform, this means that he is under the governance of the medical authorities in Egypt. Okay, so the visa for the medical patients or patients coming for medical reasons, it's much better to be done through the IT platform. There is another point is the timing of issuing the visa. You know, it has been
This is very important.
agreed
Yes. That was what my point.
in maximum 72 hours, the medical visa will be issued to the patient, and he can get it through the platform. So it's much easier. There are privileges and advantages for the patients carrying this medical visa, and I think it's much better than having or getting this visa electronically. Okay, thank you very much.
This is very great achievement, Doctor. I am happy to hear this platform is coming in 15 days time, and the travelers, healthcare travelers, can obtain their visa through this platform without going to the consulate or embassy to hassle themselves. This is a great achievement. I congratulate your ministry about this achievement, actually.
Thank you so much. We appreciate it, and next time we'll meet in Egypt.
Inshallah, I will be.
Thank you, Emin. Thank you, Dr. Samih.